My name is John Howard, and I am the director of the National Institute for Occupational Safety and Health. I want to welcome all of you here today, especially want to welcome Senator Jay Rockefeller, who we're thrilled to have with us today, Secretary of Labor Thomas Perez, Assistant Secretary of Labor for Mine Safety and Health Joseph Main, to all the coal miners that are here, their families, to congressional staff, members of the press, and all of my NIOSH colleagues. Good morning, welcome, this is a great day, and we're all thrilled that you're here. NIOSH is very pleased to host this event. Our colleagues from the Department of Labor, we're always happy to see them, and especially happy to see them today. There's an important announcement that they want to share with all of us today, and without further ado, Mr. Joseph Main.
I'm honored to be here today with U.S. Secretary of Labor Tom Perez, with the Senator from the great state of West Virginia, Senator Rockefeller, and of course those who are folks that I think about a lot, that's not only in the audience but behind us here today, and those are those who went to work in the mines or whose spouses went to work in the mines and unfortunately succumbed to the terrible black lung disease. It is for those we remember with what we do here today.
Because we're here today really to advance a very basic principle, which is that you shouldn't have to sacrifice your life for your livelihood. No one should have to die for a paycheck. And yet, that's exactly the fate of more than 76,000 miners who have died, at least in part, from black lung since 1968. And so I tend to put that in the perspective of my own life. Black lung has contributed throughout most of my lifetime to the death of roughly 5 miners each and every day. That's not right. And I've heard some who have suggested that now is not the time to enact a new rule to enhance safety, and that we should study the issue a little bit more. Well, for all too many coal miners and their family members, we have quite literally studied the issue to death. I've heard that from people, and I understand that. Too many families have buried their loved ones. Too many grandchildren are not seeing their grandparents. Too many spouses are not seeing each other. And working should never be a death sentence in America. And the dignity of work means the right to work in safe conditions. And we have known for decades, thanks to the great work at NIOSH and elsewhere, that black lung disease is a killer and it's preventable. And we're here today to say simply one word: enough. We have the tools to do something about this devastating but preventable disease. It's time to muster the will to do it, and that's precisely what we have done, because the nation made a promise to American miners back in 1969, and at long last we are making good on that promise. Today's rules will save lives, and Joe, a little bit later, is going to describe the rule in much greater detail. But it's going to reduce the amount of unhealthy coal dust that miners breathe into their lungs. It will make use of cutting-edge technology to better measure dust levels. It will improve sampling practices and increase the frequency of sampling so that we can better reflect actual working conditions. It will require mine operators to fix unhealthy dust levels when they find them, not days or sometimes weeks later. And it will expand medical surveillance programs so that we can improve early detection of black lung. Now, in developing this rule, we have proceeded not simply by talking to a few people, but by making sure we had a very, very wide table, and we spoke to all the stakeholders. Over the past years, we've worked hard to engage every segment of the community: miners, operators, health professionals, community labor leaders, and more. We've had 7 public hearings, and we've received thousands of pages of public comment. And the rule also comes with a 2-year implementation period during which we will continue to provide support and compliance guidance to coal operators. Every step of the way, we have done everything possible to bring everyone into the process. Collaboration, openness, and listening have been and will continue to be essential. Change like this is only successful if all the stakeholders absolutely feel like they hold a stake, that they have been invited to the table and will be given and have been given and will continue to be given an opportunity to be heard. And so the final rule reflects the careful consideration of and the responsiveness to the comments that we received. We made important changes from the initial proposed rule to ensure that we were providing the best protections possible in a way that is still feasible for the industry. In the end of the day, I firmly believe that we can have healthy miners without harming the coal industry. No matter what sector of the economy we're talking about, I categorically reject the false choice between job growth and job safety. We can and must have both, and this rule will enable us to continue to do that. Every day, thousands of tough, hardworking Americans, including many people in this room, leave their homes and head to the nation's mines, many of them descending below the Earth's surface, where they take on one of the hardest jobs around. It is a job most of the rest of the nation knows little about, but we depend on enormously. It's a job that's more than a job, of course. And I've spent time around here. I understand it's a way of life. It's woven into the fabric of the community. And in many cases, it's a multi-generational legacy. For everything you do to heat our homes and power our plants and strengthen our economy, the proud people who choose this way of life, you have not asked for much. You've asked simply for the opportunity to earn a decent living so that you can support your family. You want the opportunity to continue to punch your ticket to the middle class and to capture a piece of the American dream. And you want to spend your golden years with your grandchildren, bouncing your grandchildren on your knees, not having to gasp for breaths and tethered to an oxygen tank. You know that this is not a risk-free occupation, but you are asking for basic workplace safeties that will give you the chance to work productively, to live a productive life, and to maintain your health status for many years to come. Today, in a moment that's been a long time coming, we're doing just that. I'm excited to be part of it. I appreciate the leadership of everyone in the Department of Labor, most especially Joe Main, and I am confident that we are moving the ball forward in worker safety for coal miners.
I'm simply a person who didn't really discover what my mission in life was until I'd spent 2 years as a social worker in a southern West Virginia coal camp without any coal. It had all been mined out, with unemployed coal miners, many of whom had black lung, and who were just marginalized. And I've tried to make my career, 50 years in public life, all about those who have been marginalized and pushed to the bottom and ignored. But I could not do without all of you who I'm looking at. Dewey sitting right next to him. You know, Dewey, he started to say something and he coughed a little bit, and you could hear the black lung. You could hear it. I didn't point that out to him, but you could just hear it. The suffering that goes on. So you go back to that awful April 5th of 2010 in the UBB mine disaster. And what people knew was that 29 people had died. What people came to know was that 17 of them, following their autopsies, had black lung. So in a sense, they died all of a sudden, but they were on their way anyway. And one of them was a 25-year-old kid. And that just tears my heart out. You've got to keep the pressure on us. Me too. I'll be retired, but you keep the pressure on me. Because this is something I've worked on all of my life, and I really care. And it just, the thought that people are, you know, for a while people were getting older, now people are getting younger and getting black lung. And it doesn't make any sense. How can a 25-year-old, when would the 25-year-old start working? When he was 18? 17?
18 at least.
Well, I mean, that's, you know, that beats any presumption. I've always felt there was a presumption. If you've worked in the mines for underground for 10 years you were presumed to have black lung. Well, we could never get that passed, obviously, but I think that's the case. But I think we are making history here, and yet it's a history that we can talk about, but which we have to make work for you, okay? That's why you got to watch us and watch my colleagues and the federal government colleagues. It's one thing to make an announcement, it's another thing to actually make it happen. I'm really proud of what's happening, and Joe Main, I'm proud of you. We've done a lot of work together. But I want this to work. I just, you know, and I said, I spent time before, and I pointed out that my wife had cancer for 6 years, and she was given a 20% chance of living another 5 years, and she beat it. She beat it. She just bulled her way through it. Can't do that with black lung. Can't cure black lung. Can't ameliorate black lung. Can't make it better. Only thing you can do is prevent it from happening in the first place. And the only way you can do that is by having clean, respirable air. Clean air. And that's the optimism in my remark here. It is preventable. And people worry about what happens with the long wall. Well, the long wall, according to Joe Main and others, is more than taken care of by going from 2 to 1.5. More than taken care of. I think this is a tremendous step that we're taking today. And it really is a legacy type thing. It's historic. But we have to come through now with your help. We have to do what we've said we are going to do. And we can't just pretend it. We've got to actually do it. And yes, it'll take some time, because it takes some time to invent some of the black box materials, et cetera, to measure properly. But I choose to be optimistic. I choose to think that finally, at last, with our secretary and our undersecretary, assistant secretary, whatever you are, Joe, that we're going to make this happen, that you're going to make it happen. And there are no excuses for it not happening. If we don't clean it up 100%, all right, that's going to be step 2, and then we're going to have to go on to step 2. But don't tell me that you can't mine coal and still have, with ventilation and lots of sprinkling and lots of water sprinkling and lots of other things, you can't have clean air. And if a miner is breathing clean air, then a miner is going to be able to make a terrific salary, have a terrific future, be optimistic. His kids are going to, men and boys and girls are going to want to go into mining because the salary is so terrific. But they're not going to have the risk of getting black lung, because you do not return from black lung. You do not return from that horrible disease. So that's our purpose here today, is to say that we declare war on black lung, and we're taking steps to eliminate it. Dr. John Howard, I'm really grateful for NIOSH, and that's another example of where the research which is done, and innovation and forward thinking about how can we make air cleaner, how can we come up with new ways of doing that, how do we solve the, quote, mask problem in a way which miners can live with it, and yet it also does the job. And that's a big one. That's a big thing to raise. But we've got a terrific Secretary of Labor, and he means it, and so do I, and so do you. So God bless you all. And now you're going to have to forgive me. I had such a good time over there that I got tremendously late for another meeting, which I meant to go to. So it's your good fortune that I'm going to get up and walk out. And you're going to forgive me, right? Okay. Thank you. God bless you.
Thank you, Senator Rockefeller, for visiting and honoring us all today here at NIOSH. For 40 years, NIOSH has worked closely with partners here in West Virginia and all across the nation to prevent black lung disease through X-ray surveillance, improved diagnostic tools, educational outreach to miners and their families, and through publication of scientific papers bringing attention to the terrible toll that black lung takes on the nation's coal miners. Much of this progress was made possible by the work performed here in Morgantown by NIOSH and its predecessor laboratory, the Appalachian Laboratory for Occupational Respiratory Diseases. I want to recognize the work that NIOSH scientists here in Morgantown have performed in contributing to the ending of black lung disease. After a long period in which black lung disease declined in the U.S. after enactment of the 1969 Coal Mine Safety and Health Act, NIOSH surveillance data indicates that the prevalence of black lung disease is rising, as the Senator referred to before. And also, as the Senator referred to, NIOSH data shows a troubling trend of coal miners developing severe coal workers' pneumoconiosis at relatively early ages. These are miners who work under conditions mandated by the 1969 Coal Mine Act. The findings of a resurgence in black lung disease and of black lung disease in coal miners at relatively younger ages indicates that we need to do more to reduce hazardous exposures to American coal miners. And I am, on behalf of everyone at NIOSH here in Morgantown, thank you, Secretary Perez, thank you, Assistant Secretary Main, for choosing our location to make your announcement. Mr. Main.
Thank you, John. And what I think would be fitting to, let's hear some of the voices of the miners and their families themselves been afflicted by this disease that really, I think, makes clear why are we doing what we're doing. First, I'd like to introduce Carol Miller, who is the widow of Ronald Miller. He died last year from complications of CWP, we all know commonly as black lung, at the age of 64. He started in the mines at age 18, like many of us did, and worked as a miner for nearly 22 years, stopping in 2006. Carol, thank you for being with us today, and if you want to take a couple moments to share what it was like.
All right. Thank you for having me today. I want to say that it's a privilege to be here with all of you, and I've gone through firsthand what it's like to lose your spouse to this dreadful disease, and hopefully, you know, that one day there will be a way where there is clean air in those mines for the young men coming up in our society today who will be working in those mines. And when Ronnie died, my life died. I watched him suffer with this horrible disease. He was on life support for 17 days, and then he awoke, and he was with me for a couple of more days, and then he was gone. And, you know, all the things he loved all of his life, like hunting and, you know, the mountains and, you know, riding the four-wheeler and everything, just walking down to the mailbox, you know, those things were gone for him because of black lung. And I hope all of us never forget, you know, any of our loved ones, and just continue to do whatever we can to support everyone. And thank you.
Thank you, Carol. You got to see the voices of some of the miners in the video that we just previewed a few minutes ago. One of them, unfortunately, is not with us today, who passed away as a result of the disease. We have Dewey Kemper, who's here with us today, who has complicated CWP, and just last week was evaluated for a lung transplant, which is something that many miners face that is not realized. Dewey started working in the mines at age 20. He worked underground for about 28 years. And Dewey, we thank you for being with us today, but your story is the same story of many of others, if you would share that with us.
Yes, I worked for 28 years, never really had any serious injuries, and now I can't work anymore.
We love you, Dewey. I don't think it takes much more than that to explain why we're here today. And I know Dewey's hope is that other miners don't see the same fate that he did, and we're about ready to fix that. Gary Harrison was a miner. He was an electrician working on a coal mining equipment, a job he really loved, and I know that, Gary, from knowing you. He found out he had black lung, CWP, in his early 40s, and he also started in the mines at age 20, and he got about 28 years in until black lung caught up with him. And Gary, if you want to share your story with our folks.
When I really found out, every time I think about this, oh, glory, to realize that I never I thought I'd be working until I was at least 60-some years old, or even a little bit longer. To find out at 48 years old that my life really changed, that I couldn't do what I used to do. We were brought up that you were the caregiver, you the provider of your household. After 12 years out of being out of mine, I still hurt when my wife go out the door to work. Because I look at that's supposed to be me. I'm supposed to be providing for my family. And she going out to help compensate for what we owe, to pay back to people that we borrowed from, or things we bought. And it hurts. And most men knew that got families, and you supposed to be that provider, you supposed to be that caregiver, that you can't do what you used to do. You can't be what you used to be. And I watched my younger brother, he breathing almost worse than me, and he's still in the coal mines. And not only that, I got oxygen sitting right back here, and my wife tried to get me to use it, and I'm telling you, it's hard to know that you got to start depending on something. As you look at the film, the doctor told me within 2 years, if I had stayed in the coal mines, that I'd have been on oxygen. The very thing I was trying to keep from doing, I'm starting to do. And I tell you, it really hurts. And I got a grandson that he loved playing basketball. I would love to be out there teaching him how to play. But I got to sit on Saturday. If I shoot 2 or 3 times, I got to go sit down somewhere. You know, I can't help him to learn how to play like we was taught when we come up. It's a hurting feeling that you can't do the things that you want to do and go where you want to go and help people like you want to help because you got a limitation now. And I'm praying that this bill will change the situation, the circumstances that our young people will be facing. And I'm praying that the dust will be eliminated. And we will be able to see that they be able to do stuff with their kids and with their families. And we won't have to worry about having something to rely on. Like I say, it's hard for me to start thinking I got to rely on oxygen. The very thing that I was hoping I'd never have to do. My dad is 88 years old this year. He got black lung. But yet he walked through the house, and I know he need oxygen, but he still ain't using it. I thought I may be able to do the same thing, but seemed like mine may be a little more progressive than what his is. Thank you.
That's why I took this job. I'd like to start today sharing a story about a close friend of mine, someone that was a friend of a lot of folks in this audience today. He's Mike South, coal miner. And he became a coal miner like all of us did. Want to get a better life, want to feed their families, want to get a good job to pay a good wage. It's an honorable occupation. It's a fundamental piece of an American economy that has produced more electricity and manufactured more goods than you could probably ever imagine. When Mike found out he had black lung, he, like others, was robbed of the opportunity to work, retire, and enjoy the things that others experienced. He had to leave the mines due to his health. We all know Mike walked around with an oxygen bottle just to get the next breath of air to stay alive on this earth. Mike was fortunate enough to get a lung transplant. As a matter of fact, he had a double lung transplant. I'll never forget the day that Mike went to the hospital. But it wasn't good enough. A few months later, he passed away. Mike's story is much like the stories of Chester Fike, of the stories you heard here today. And many of us know these miners that we're talking about, miners we have with us on the stage here today. Each one of them chose to be a coal miner for what it gave their family. And none deserved what it took away. It's because of the stories like Mike and Chester's and Ronald's that when I arrived at MSHA over 4 years ago, my first action that I launched was the End Black Lung Act Now campaign. That initiative included education and outreach with the mining industry, along with a commitment to do rulemaking, which we're about to do today. While our campaign has made progress, we know there's still more to be done to end this terrible disease. Today, we are here to take an historical next step in that campaign to end a preventable but incurable disease afflicting miners. For those that have lived in the coal communities and seen the devastation the disease causes miners and their families and their communities, they don't have to ask, why are we announcing a new rule to end this disease? They know why. Many of us, miners who at an early age went to work in the mines, some of us survived, some were stricken with the disease, like Mike and Chester and Gary. The numbers are important but abstract. As noted, 76,000 miners have died from complications of black lung or the disease itself. $45 billion have been spent to compensate over 200,000 miners who have been afflicted with this disease. But until you've walked in the shoes of these miners and their families, experienced the hardship, the grief, the loss, you don't understand what black lung is. A disease that could have and should have been eradicated long ago is still with us today. Investigations has been noted into the cause of the April 5th, 2010 Upper Big Branch disaster found that 17 of those miners who lost their lives in the explosion had black lung, including younger miners and with just a few years underground. I talked with a field clinic that sees black lung patients, and they will tell you that they still see miners afflicted with the disease walking through their clinic doors, even younger miners. The National Institute for Safety and Health, NIOSH, where we're at today, has identified over 1,000 cases of the disease in working miners across this country during the most recent 10-year period. Black lung is incurable, but is also preventable. but we haven't prevented it. Those who say that black lung is a thing of the past are just dead wrong. It is still here, and it's time to come to terms with that distasteful fact and end this disease now. That is why today we're announcing a new rule to reform the respirable coal dust standard in this country to end the disease. The new rule that we're talking about, which is a result of years of work that has involved labor, industry, and public input along the way, has been carefully crafted to protect miners. The rulemaking is based on the best science, the most inclusive rulemaking process, the use of the latest technology. It is a product of input from the public, including miners, mine operators, labor, industry organizations, medical professionals, advocates, and others. The final rule gave a great deal of consideration to that public input and is a strategic and balanced approach to have in place common sense protections for miners that are feasible for the mining industry. This rule finally makes good on a promise made by Congress more than 40 years ago. The rule will better protect miners in several ways, and I'm going to walk through those. The rule lowers miners' exposure to coal mine dust as it closes loopholes that have exposed miners to high levels of dust, improves the way that we test the mine air for dust, and increases the frequency of those tests in mines. These critical changes include the following. The rule changes the practice of allowing dust conditions to languish days or weeks when a miner is exposed before corrective actions are even taken. The new rule ends those practices and will require mine operators to fix the high dust levels as soon as they are detected, before they can hurt miners. And because the rule also introduces new cutting-edge sampling technology that many of us in this room worked on over the years that will be phased in, miners and mine operators will have that real-time information on dust levels, and that's throughout the mining shift. This technology was developed and tested over several years by the mining industry, labor, and government, and its reliability and accuracy for sampling has been verified by NIOSH. As both an engineering tool and enforcement tool, it will allow dust to be monitored and known in real time during the shift so we can make adjustments quickly. To put it simply, this technology is going to save lives. We've made other changes to ensure that miners are protected from high dust when it's detected. For example, we've changed the method of averaging dust samples, which previously allowed miners on some shifts to be exposed to levels above the standard. This loophole allowed miners to be exposed to more than 3 milligrams of dust, even though the standard said 2, with no correction action required at all. This will not be tolerated under the new rule. Moving forward, when any dust sample exceeds the standard that's set, mine operators must take immediate corrective action. The new rule requires that sampling be conducted on consecutive shifts. Under the current rule that we've been operating under, mine operators are permitted to sample on consecutive days, which means that some shifts can go indefinitely without ever having an operator dust sample. We're closing that loophole. Another key protection addresses production thresholds for sampling. Currently, sampling of miners can occur when coal is only half the normal production levels and less dust is generated. It doesn't take a rocket scientist to understand that if you're producing 1,000 tons a day and you only have to take a sample of the miner when it's at 500 tons a day, that you're not really measuring the dust that miners are breathing. Sampling with that low dust level really has been masking the dust that miners have been breathing over time. We've increased that requirement to at least 80% to reflect better and more normal working conditions. The new rule ends the practice of shutting off the dust sampling device after 8 hours, and this is something I think many folks didn't understand. Miners working 9, 10, or 12-hour shifts, when 480 minutes hit, that sampler was shut off, taken out of the mines. The remainder of those shifts were never measured. That changes with this rule. We'll be measuring the miners' exposure for the full shifts, regardless of their length. The current rule requires operators to sample only 5% of the coal production shifts. Think about that. We talk about what the standard should be and how it affects miners. There is about 95% of the time that the coal production shifts weren't even sampled. That's a problem. The new rule fixes that by increasing the number of shifts to be sampled, which will more effectively monitor the dust miners are breathing. For those who have looked at the actions that I have taken after the Upper Big Branch mine, have heard about the impact inspection program. That impact inspection approach that I have developed for those troubled mines will also be applied to the new respirable dust rule. If we find mines where operators are cutting corners and allowing dust to rise to unhealthy levels, we're going to keep a closer eye on those mines. For example, if we find mines like Sane Creek, and you may have read about that one, where an impact inspection went in where we captured the phones before the operator could get word underground, and found that they were operating with basic dust controls not even in place, cloud of dust that the miners were working in. Or if you looked at the Upper Big Branch findings and saw the results where when we did the investigation, we found the shear of the lung wall that didn't even have water sprays in to use to spray to douse the respirable dust. These basic protections were just not there for the miners. MSHA can require, under this rule, when it phases in, more frequent sampling at those mines, and we will. In addition to the measures I described that will, on their own, reduce miners' exposures to dust, the rule is also going to lower the maximum dust levels over time. Areas in underground mines where coal is produced and surface mines will have a 1.5 milligram standard that will replace the current 2 milligram standard. In the rest of underground mines, areas outside of the production phase, in areas of the mine where miners with evidence of black lung work, the allowable dust levels is being cut in half from 1 milligram to half a milligram. The rule will go a long way to ensure that the controls are actually in place by improving the quality of examinations of the dust controls in the sampling process. The rules require mine operators to put their names on the line to make sure that happens. Top mine officials will now have to certify that they've conducted more specific examinations that's going to be required under this rule each shift of the dust controls, and to assure that those controls are in place, unlike the current circumstance we have, which led to conditions like we found, we believe, at Upper Big Branch, where there was no accountability for really making examinations at the end of the day. These measures will help prevent these kind of unconscionable dust problems. The new rule expands the medical surveillance program to now include surface miners. And it's also going to expand to include lung function testing for all miners, surface miners or underground miners. This will allow miners to have an understanding of their own health to better enable them to make choices. We're taking a common sense approach to implementation, including a step-by-step phase-in that systematically improves protections for miners, that allows time for operators to secure the needed devices and to invest and implement better dust controls. Improved sampling requirements will begin on the effective date of August the 1st. That is those loophole actions that we're going to take to change the way that we're actually sampling in the mines. The requirement for this new dust sampling device is going to be a game changer for the mining industry and for ending this disease. A continuous personal dust monitor that gives instantaneous readouts of the dust levels will go into effect February the 1st, 2016. The manufacturer has to develop and build the devices yet that's already been approved by MSHA. Finally, the changes of the dust standards, the lowering the standards themselves, will be effective 24 months after the effective date, and that will occur on August the 1st, 2016, when all of these changes will be in place. And make no mistake about it, the rule holds mine operators accountable for implementing and maintaining necessary dust controls to protect miners from black lung. But for mine operators who want to do the right thing and better protect their miners, we're going to be there to help them. We will give them the technical assistance and the information to meet the promise of this rule for their miners without undermining their ability to run their businesses that our country so critically depends upon. We just briefed the families affected by the disease in an earlier session this morning about the actions that we're taking. We're going to be meeting with labor and industry stakeholders and congressional representatives tomorrow and explaining in more detail the rule. And I plan to make a challenge to the mining industry and labor tomorrow morning. Join with us, excuse me, in an alliance that we start moving forward day one to implement all these protections that we've talked about. The MSHA is going to be there as an agency that's going to help get these protections in place. We're also going to be holding meetings and briefings in the coal fields here that's going to be starting very shortly, where we can meet with miners and mine operators directly and explain what the rules are and how they need to be implemented to make sure everybody, to the extent we can be fully informed of how this rule will be implemented. With each step of the rule, from August the 1st of this year, February the 1st of 2016, and August the 1st of 2016, we are going to make improvements in the environment of these mines to control this unhealthy dust. All of the changes in a rule that will be reflected in a final rule is posted as of now on our website.